If you have struggled with infertility and are either considering or planning to use IVF, this presentation will cover a test that you can add to your IVF cycle that may increase your chance of getting pregnant and having a healthy birth. I am Melissa Meisenbacher, a board-certified genetic counselor with Natera. Previous to working for Natera, I have been employed by the Children's Hospital of Philadelphia and the University of Florida, primarily working in pediatric genetics. I currently serve on the board of the International 22q11.2 Deletion Foundation and am a member of the National Society of Genetic Counselors. I joined Natera in 2009 because of my interest both personally and professionally in helping couples with infertility. In this presentation, I will be focusing on Natera's aneuploidy preimplantation genetic diagnosis, or PGD, which is sometimes referred to as preimplantation genetic screening, or PGS. In addition to aneuploidy PGD, Natera also offers a variety of other tests for couples undergoing IVF or with fertility problems such as miscarriages. Preimplantation genetic diagnosis for both single gene disorders and chromosome rearrangements, including translocations, is available through Natera, as is chromosome testing for miscarriages, non-invasive prenatal testing, and carrier screening. Additional information about these testing options can be found on Natera's website. Natera's parental support testing uses a new technology, microarray-based testing, for preimplantation genetic diagnosis, or PGD. Our testing is designed to examine all 24 chromosomes, the numbered pairs 1 through 22, and the X and the Y chromosome, for missing or extra chromosomes, termed aneuploidy, in either one cell from day 3 embryos or multiple cells from day 5 embryos. The normal number of chromosomes in a human is 46, 23 pairs. One of each pair is inherited from each parent. Embryos with too many or too few chromosomes most often result in no implantation or early miscarriage, and less often result in a baby with a chromosome condition, such as Down syndrome. Since our inception in October of 2008, it seems that we at Natera are seeing an increase in the pregnancy and live birth rates and a decrease in the miscarriage rate for our patients when compared to individuals using no aneuploidy PGD testing or other forms of PGD testing, although a formal randomized control trial needs to be conducted to give statistically significant numbers. Currently, we have a 50% overall pregnancy rate for our patients who have had a transfer after testing. These benefits may be associated with the fact that we are able to screen all 24 chromosomes, something not possible with older methods of aneuploidy PGD. Additionally, our testing has been validated in preclinical trials with results published in the medical literature, and averages 99% or greater confidence in the results returned, making this a more reliable PGD method than offered in the past. Research has identified some specific groups of people who may benefit from aneuploidy PGD testing. Because PGD technologies are relatively new, there may be clinical benefits for other groups as well. For couples who are considering IVF, aneuploidy PGD used in conjunction with IVF may have a clinical benefit. Women who are 35 years or older are known to be at a higher risk of having a pregnancy with a chromosome abnormality. Therefore, aneuploidy PGD testing may be useful in selecting embryos for transfer that are most likely to have normal chromosomes. Some studies of couples with more than one miscarriage of unknown cause have shown a higher rate of embryos with chromosome abnormalities than expected. These couples may also benefit from aneuploidy PGD testing. For couples with 3 or more miscarriages, it is recommended that both parents have a routine chromosome analysis done to rule out a balanced rearrangement. This study can be discussed further with your doctor. Couples who have had a prior pregnancy or child with a chromosome abnormality, or who are concerned about having a child with a chromosome abnormality, may choose to use aneuploidy PGD during an IVF cycle to reduce the risk of transferring an embryo with aneuploidy. Lastly, there is some data that suggests for couples with previous unsuccessful IVF cycle or cycles, PGD may increase the rate of pregnancy. As I mentioned, the majority of embryos with chromosome abnormalities will not implant or will result in an early miscarriage. By testing day 3 or day 5 embryos for aneuploidy across all chromosomes, you enable your IVF doctor to select for transfer those embryos most likely to be chromosomally normal, which may increase the chance that you will become pregnant and may decrease the chance for a miscarriage. Parental support is designed to test day 3 or day 5 embryos and return the results to your IVF doctor directly. Testing done on day 3 will return results on the morning of day 5. This will enable you to have a fresh transfer done. That is, no embryo freezing is necessary. Testing done on day 5 takes 1 week to return results. The embryos are frozen after biopsy and can be transferred in a later cycle. There are benefits and limitations associated with both day 3 and day 5 testing, which you can discuss with your IVF doctor or find out more about on our website. Parental support is the only type of PGD testing that uses parental DNA as reference material for testing embryo DNA. This direct comparison allows Natera to calculate a test confidence level specific to each individual embryo cell and each chromosome within each cell analyzed. Typically, our confidence levels are greater than or equal to 99%. In addition to testing for aneuploidy across all 24 chromosomes, Natera's parental support testing can also detect other chromosome abnormalities not detected by other forms of aneuploidy PGD. If you would like more information about this testing and what is detected, please see our website. Lastly, parental support testing can also determine the parent of origin for chromosome abnormalities found in embryo samples. This may be helpful in looking for patterns of chromosome abnormalities and in making recommendations about which embryos are best for transfer. There are limitations to all forms of PGD testing, which are outlined in more detail on our website. If you have any more questions about Natera's parental support testing and how it relates to your specific IVF cycle, please refer to the Frequently Asked Questions section on our website and our more detailed presentations posted there. If you have questions after viewing this information, you can contact Natera by email. If you need help in finding a participating IVF center or would like to know if your IVF center is currently working with Natera, please visit our website and refer to the Partner IVF Clinics page. Thank you for taking the time to listen to the information about our parental support testing. We at Natera are dedicated to helping doctors give patients the best chance of having a healthy child, and we hope this information may move you towards that goal.